Welcome everyone to today's presentation dealing with the series Heal Their Land. I want to welcome everyone and especially those who are joining us even after the event via the video on the internet and the video that you may have received via DVD. I want to welcome you and invite you to also come back tomorrow, because we're going to be having one more presentation in the series tomorrow. Not here, but right over there on the other side of the Capitol grounds. So, what are we going to be talking about tonight? Well, in terms of my presentation, I've entitled it, The Emerging Crisis. The Emerging Crisis. What is this crisis that we're talking about? Well, I want to show you something. There is a disease that is afflicting individuals in the United States of America more than any other disease in the history of our country. You want to know what it is? It's right here on the screen. Can anyone read that? It's Latin. Okay. Lactillus solanum tuberosum. Let me just give you a little bit of information about this disease before I really give you a graphic representation of this disease. First of all, this disease is one of the causative factors for millions of people's deaths in the United States of America each year. It sounds pretty bad, right? Sounds pretty deadly. Now, are you ready to see the picture? Are you ready? It's kind of gruesome. Lactillus solanum tuberosum is Latin for couch potato. Okay, and I didn't make this up. The Journal of the American Medical Association says modifiable behavioral risk factors are the leading causes of mortality in the United States. What does that mean? It simply means the choices that we make, whether it be in physical activity or diet or what we put into our bodies, whether it be tobacco or alcohol. These things are the leading causes of death in the United States of America. Okay, so now you see why being a couch potato is so deadly, right? Well, those are the causes. These are the effects. We've talked about this on subsequent nights. We're going to mention it again because I want you to see something more than just the immediate statistics. I want you to see where this has come from and also where it's going, because it really is startling to see how quickly our country has changed in terms of its health in the last 30 years. As of right now, 25% of Americans will die from heart disease. 40 will develop cancer. We said that 20% of those 40 would die from cancer eventually. 50% will be obese by the year 2025. 27% are pre-diabetic, and over 100,000, 130,000 potentially will die from a stroke this year alone. So let's take a look at one of these factors right now. Obesity. You would be surprised to know what has happened since the year 1985. And I'm going to show you what the CDC has been compiling right here via the maps that indicate the percentages of obese persons per state in each state. It's a percentage of the levels of obesity in each one of these states that you see depicted here on the map. We're going to go fairly quickly through these maps because we have a lot to get through with this presentation. Let's go ahead and start. You see 1985, there were a couple states depicted here that had 10 to 15% obesity in the state. Now let's go 5 years ahead and let's see what happens. Can you see what's going on here? In 5 years? What just happened in 5 years' time? We had a great increase, right, in the level of obesity. We jumped, well, some of the states hadn't entered data yet, but we see now that almost all the states are participating in the study But yet now we have some states that are up to 15 to 19% in just 6 years' time. So let's go on now. Keep your eyes on this map because you're going to see some pretty intense changes. Now, 5 years later, what happened? We had a tremendous increase in the level of obesity in this country in just 5 years. We jumped from almost 10 to 14% obesity in most of the country, now to 15 to 19% obesity in most of the country. Now let's go on. Here we go. Now there's some states that are appearing to have 20 to 24% obesity. Look at 1999. What happened in the year 1999? Take a look at this, 1998 to 1999. That's a tremendous increase in obesity right there. 2000, let's keep going. Now we see some states that have increased to the level of 1/4 to almost 1/3 of their population is obese. And then continuing on up until the last data set in these studies, 2010, what's going on here? Now some of the states are showing greater than 30% obesity. It's interesting to note that the CDC started to change their methods of data gathering after this. And so now we can't compare the new data to the old data. But one thing that we know, and that's the projection for obesity. The experts project that by the year 2025, just 9 years from now, 1 out of every 2 Americans will be obese. 1 out of every 2 Americans will be obese. Do you see how quickly that happened? Does everyone see that? Okay. Now let's look at another issue here. Diabetes. In 1994, which was the year this set of data was put together, we actually had many states with 4.5 to 5.9% diagnosed diabetes in the country. Well, let's go through this very quickly and let's take a look at what's happening. Let's go to 2000. What do we see happen? A jump up to the next category, right? 6.0 to 7.4% by the year 2000. Let's keep going. Now we see some states even up to over 9% of the population diagnosed with diabetes. And the situation is not improving, is it? By the year 2010, what's going on? Over 1/3 of the country is at equal or greater to 9% diabetes. Okay, let's take a look at heart disease. I'm not going to give you a whole realm of maps to look at with heart disease. I just want you to tell me, where do you see the greatest concentration of heart disease in this map?
The South.
It's in the South, right? Now, were you paying attention with the obesity levels and also the diabetes levels? Where were those centered?
South.
The South, right? Okay, let's go to stroke as well. Where's stroke being centered as well?
South.
Now, what is the South?
Home cooking.
It's home cooking, okay? What else is the South? It's known as the Bible Belt. Now, it's very amazing to note that the Bible Belt is also the stroke belt. The Bible Belt is also the cardiovascular disease belt. The Bible Belt is also the diabetes belt. And the Bible Belt is also the obesity belt. What's going on here in this country? Didn't we learn that when we follow biblical principle, good health is a result? Take a look at this. Exodus 15:26. We read this when we realized that the Egyptians during this time were still dying from things like heart disease, diabetes, cancer, stroke. and obesity. And yet God said, if you will diligently listen to the voice of the Lord your God and do that which is right in his eyes and give ear to his commandments and keep all his statutes, I will put none of the diseases on you that I put upon the Egyptians, for I am the Lord your healer. God promises he's not going to put these chronic diseases upon us. So what's the missing factor here then? Why is it that the most religious portion of our country is suffering from such chronic disease? Does anyone have any idea? Could it be that we have forgotten to diligently listen to the voice of the Lord our God? How do we diligently listen to the voice of the Lord our God? Does anyone have any idea? Through his word. Could it be that a country that was based on religious principle, a country that in a recent poll, the majority of respondents said, I'm a Christian, could it be that we've started to forget what God has told us to do, not only for our health, but maybe even for other things? Could it be? I want you to contemplate that for a minute. But I want to submit to you that this crisis is far greater than many realize. This was published by the CDC recently. They said chronic diseases such as heart disease, cancer, and diabetes are responsible for 7 out of every 10 deaths in America each year and account for 75% of the nation's health spending. What is happening because of our increasing debility? What is happening economically speaking? We're spending a lot more on health care. Do you recognize that? But brothers and sisters, it doesn't have to be that way. We don't just need to have people sick to have a good economy. You know that? In fact, it's not even biblical to have people sick to have a good economy. In the book of Psalms 105:37, it reads, He brought them forth. This is God bringing forth the children of Israel from the land of Egypt. He brought them forth also with silver and gold, and there was none feeble person among their tribes. What does this show us? You can have a good economy and you can be healthy as well in the biblical sense. But I'll submit to you, there is one entity who would like to see us sick, who would like to see us debilitated, who would like to see our country lose a lot of its freedoms. And it's talked about in Matthew 12:25. It says, or else how can one enter into a strong man's house and spoil his goods, except he first bind the strong man, and then he will spoil his house. We are being spoiled today. Our country is being spoiled. And is being spoiled, for the most part, by a lack of education, a lack of healthy decisions. And ultimately that comes, I'll submit to you, from a lack of the knowledge of biblical principle. It's interesting, during the Dark Ages, they had tremendous amount of plagues and pestilences, but during the Renaissance, during the spiritual great religious awakening of the Protestant Reformation, people started to read in the Bible. They started to realize, hey, the Bible says to bury your excrement and to wash yourselves with water. This was revolutionary to those people. Do you realize Louis XIV, the King of France, boasted that he had only taken a bath 3 to 4 times in his life? No, he was known as the perfume king. Why was he so resistant to taking a bath? It was because he didn't know much about what the Bible had to say about cleanliness. And neither did his subjects. And because of that, many diseases came upon them. But it's amazing. When we look at our modern day system of healthcare, we can shudder at the amount not only of diseases that we're seeing springing up, but also at the overall cost of this entity. The Congressional Budget Office actually put together some tabulations, and they realized that by the year 2058, if nothing changes with healthcare spending, by the year 2058, 58%, not 58%, this is more like 70% of the gross domestic product will be spent on healthcare. 70%. Now that's startling when you think of what the gross domestic product is. That means all the profiting, all the industries that are contributing to the welfare of our economy. That would show us there are going to be a lot of sick people in this country by the year 2058 if things don't change. And it's also showing us that we're in trouble economically speaking. Andrew J. Rettenmeyer, Associate Director of the Private Enterprise Research Center at Texas A&M University, had this to say on this scenario that we see unfolding. If healthcare spending and personal consumption continue to grow as they have in the past, number one, investment will decline and economic growth will slow and maybe even grind to a halt. We can instead move to a more rational decision in which people make their own choices. But how are people going to make healthy choices if we're neglecting healthy principles and health education? For every dollar spent on healthcare in this country, we spend maybe 2 to 3 cents on prevention. We're greatly deficient in this area. But it is good economically speaking, at least for a little while. You realize since Medicare was passed in 1966, the gross domestic product has grown by leaps and bounds, tremendously. Why is that? Because there's a lot of money to be made when people are sick. Why is that? Because they're willing to pay a lot of money to stay alive. You know, the Bible says in the book of Job, and this is actually recorded as Satan saying this. He said, skin for skin, all the man hath, he will give for his life. You're willing to mortgage your house to pay for the bypass surgery, right? It may cost $60,000, $70,000, but you're willing to pay for it just to have another breath. But you know what the problem also has come about with this situation, this lack of prevention and wellness education? There are industries that have basically profited off of unhealthful decisions. If you look at these major causes of death in the United States today, smoking, is that an industry? The tobacco industry, $1 trillion industry. Poor diet, is that an industry? Fast food is $1 trillion industry, right? There may be some good choices there, but the vast majority are probably going to contribute to a poor diet. Physical inactivity, there may not be an industry that tells you to sit down and just not do anything, but there are industries that profit off of that, right? I mean, look at the media. We sit down and we can become a couch potato, correct? Because we've got something to do, yet it's not physically active. And then alcohol consumption. We know that the alcohol beverage industry is another $1 trillion industry. And so each one of these is profiting from these unhealthful decisions. This is why our gross domestic product is skyrocketing. But is that such a good thing? Is that such a good thing? In Isaiah 58:2, it says, my people are destroyed for a lack of knowledge. And listen to this, because thou hast rejected knowledge, I also will reject thee, seeing thou hast forgotten the law of thy God. We cannot leave our personal responsibility, however, which was given to us in such passages as Luke 9:2. Jesus said to his disciples, preach the kingdom of God and heal the sick. We can't leave that to organizations or to legislation. It's a personal command. It's a personal command. God has given Christians the office of being helpers with others' physical infirmities. He's given Christians the commission to go out and show men and women that they are destroying themselves for lack of knowledge. He's given Christians the love-motivated work that can save this country. And I'll submit to you, unless we do it, no one else is going to do it. Let me tell you a story in closing. A good friend of mine is a board-certified specialist in prevention medicine, and he actually went to a hospital in Southern California at one point with a very innovative plan to reduce the levels of cardiovascular disease in this certain population surrounding the hospital. The CEO of the hospital really liked the plan. He said, this could save a lot of people's lives. I'm going to take it to the board. We're going to see if we can get you funding, and we're going to see how we can make this work. He came back a certain number of days later. You know what he said? He said, I'm sorry. We realized that if we lost the income from just one cardiac bypass surgery, we would not be able to compete with the hospitals down the road. We can't do your program. I'm very sorry. Brothers and sisters, we can't leave our personal responsibility as being Christians, as going out and ministering to others as Christ did, which Christ spent more time healing than he did preaching. Okay? We can't leave that responsibility to institutions or to legislation. We have to take it upon ourselves to help people in their time of need. Let it not be said of us what's said here in Isaiah 58, verse 2. Yet they seek me daily and delight to know my ways, as a nation that did righteousness and forsook not the ordinance of their God. Ladies and gentlemen, it's time for us to start living up to our namesake. We declare that we are one nation under God, indivisible, with liberty and justice for all. But are we truly practicing what we preach? Are we truly living up to this designation of being a Christian nation?